Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. In this segment, we'll be speaking with Dr. Matthew Old, Director of the Department of Otolaryngology, Head and Neck Surgery at the James Ohio State University Comprehensive Cancer Center. He's joining us to discuss HPV-related cancer, treatments, detection, and why vaccination is so important in older adults. Welcome to Health Professional Radio, Dr. Matthew Old. Thank you for joining us this morning.
Thank you so much for having me talk about this subject. I appreciate it.
So explain to our listeners who may not be familiar, what is HPV?
Yeah, so HPV is human papillomavirus, a very common virus that is all over and ubiquitous. We generally think of it as causing warts, but it's very well known to cause cervical cancer in women. And we discovered a couple decades ago and now are seeing the effects that it also can cause head and neck cancer, particularly cancers of the tonsil and the back of the tongue or base of the tongue. And we're seeing a really increased incidence in that, in particular in the age group of 45 to 65.
Now, you mentioned some of the areas where this cancer can occur. What are some of the symptoms of HPV infection? Are there higher risk forms or lower risk, or is it all the same? Is HPV just simply HPV and you're done?
Yeah, that's a great question. So the HPV has many, many, many different subtypes, and there are certain subtypes that have a predilection to be what's considered higher risk. And those subtypes are the ones that can cause cervical cancer and head and neck cancer. And that's where the vaccine comes in. The unfortunate thing about this virus is that most infections are actually completely asymptomatic, meaning people can have an infection and they just don't know about it. This can go on for weeks, months, even years. And so that's how it spreads so easily and why we're seeing a problem now.
What puts people, I guess, at the most risk for contracting HPV if it's out there in such prevalence?
Yeah, so it's transmitted through saliva and sexual contact. And so, increased activities related to, sexual contact, particularly at a younger age or if you're unvaccinated, the more partners you have, the higher risk in general that you may be contracting that. There are also other modalities that can transmit it because it can be in the saliva. So there are many different ways, and most people that have it don't know they have it. So that's how it can spread from one person to another. But it only takes one contact to have that infection. And if it's one of those high risk subtypes, it can then put you at risk for either cervical cancer or head and neck cancer later on in your life.
HPV is not cancer, correct?
That's a great question. Yeah, it's not cancer.
How does it lead to cancer in some and not in others?
Yeah, that's something we're trying to figure out. But we think that there's early evidence that the longer that you have an infection, the more genetic change that the virus makes, either in the cervix or in the back of the tongue or tonsil, and those cells, that it inserts itself in certain ways in the gene that then promote a cancer later on in your life. And so we do think that it's that persistent infection that puts people at a higher risk for it. But we don't know. We're still trying to figure that out to definitively prove that.
How is it detected? What is the test for HPV? And I heard you mention a vaccine.
The way it's is essentially, a pap smear for women, and that's the best. boys to prevent cervical cancer and then genital warts. But now, since about 2018, the FDA has opened up its indications and its age group. And so it's really up to the age of 45, and it's recommended to be given at vaccination age before sexual activity starts to be the most effective, and it contains all the high-risk subtypes that can cause these cancers. And so the earlier it can be given, the more effective it is at preventing the actual infection that could then later on lead to problems.
You talk about sexual activity, especially among the younger, increased partners. If someone isn't vaccinated before they're sexually active, have they just missed their chance?
Well, it depends. I think it's likely if you look at a group of people, it's going to be less effective. But there are many different subtypes, and so the important thing is it still could be effective at preventing a future infection, and in particular if they haven't been exposed to one of the high-risk subtypes. And so that's why we still recommend it, and it's very important for patients to have a conversation with their primary care doctor to understand whether the vaccine would be right for them.
Although there is no cure for this virus, how is it treated? And then give us a website where we can learn more.
Sure. The best way to prevent these cancers is obviously vaccination and then education and safe sexual practice. But if someone does develop a cancer, particularly in the head and neck region, it's an active area where we are really trying to improve patients' quality of life, because it's actually very curable, these cancers, but not without significant impact to their quality of life. And so there's different modalities. There's surgical modalities, and there's radiation and chemotherapy, and sometimes the whole combination is what is necessary to cure these cancers. But because we're seeing such an increased incidence, and we expect to in the next 20 years, that this may be one of the more common cancers in the age group of 45 to 65, we're really pushing education earlier and earlier towards vaccination to hopefully curb this tide that we're seeing. But for more information, you can link to cancer.osu.edu and learn more about it.
Doctors, thank you so much for joining us here on Health Professional Radio.
Thank you so much for having me. I appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Matthew Old. Audio copies of this program are available at healthprofessionalradio.com.au and also on Anchor, Spotify. And be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.